Welcome, everybody. We're so delighted that you're here with us today. Quick reminder for your view, you want to make sure that you've got your speaker view on, and that should, I hope, have whoever is speaking. If you have any questions, do feel free to put that into the chat. You will remain muted, but are able to engage in the chat throughout this. We do have talking permitted when we have Q&A if we'd like to at the end, but we're very active in the chat and really pleased to see everybody here today. I just wanted to start first by acknowledging all of the hard work that everybody has done over the course of COVID-19. It has been incredibly challenging as a time, and I'm afraid to say that it's not necessarily going to be magically better. And part of why we're having this important conversation today is to ensure that we as Albertans, we as Canadians are in the best possible position to take care of our vaccine health, to dispel some of those myths and concerns, and also to talk about, preventative health most generally. So we're delighted to have this conversation today. We are joined from people across the country. And so I want us all to take a minute and ponder our important work on truth and reconciliation today. So whichever part of this country you are finding yourself in today, I ask that you take a moment and acknowledge the traditional owners of the land, and that we are all participating in the important work of truth and reconciliation together. For accessibility, this program is being presented with live captionings. To view the captions, please follow the link that you'll see in the chat. The caption viewer is open then in a new window or tab. We are also recording this session, so we know that the people who are attending now will be sharing this information, and we'll also be re-recording this on a number of times. So just a quick note that it is being recorded. For other housekeeping instructions, again, please be active in the chat. We're thankful that you are actively engaged and reflecting. If there's any technical concerns or challenges that you have, please let us know, and we will make sure that in the chat, we will sort them out for you. Today is an exciting conversation with some of the leaders in the field. There could be no better person to start off our important conversation with than the Honorable Josephine Pon, our Minister for Seniors and Housing. After that, we're going to be moving in our agenda to Karen Sullivan, who has been a leader in the field from Shoppers Drug Mart. You can just imagine the work that she has done in the course of these last 2 years to make sure that preventive health and vaccination are both available, but also myths being dispelled, and thinking about how we can all work together from that public-private partnership that we've all relied on so very much to make sure that pharmacies are a core health hub in our communities. And we're delighted to have her today, and she will be interested by our colleague, Dr. Jia who is representing 19-0, and I'll share more information about that. We're so delighted to bring this with you in partnership with 19-0, which is a wonderful not-for-profit organization which is focused on vaccinations. We'll do a quick health break at about 10 o'clock Mountain, and then we'll go into our conversation with Dr. Jia and myself, and we're going to really get into the important information around vaccines, questions and answers, things you need to know, but also comorbidities. How is it that if you're living with diabetes or living with a heart condition or trying to figure out what you need to be most worried about, this is the focus point of it. And it's going to be dynamic and it's going to be fun. And we'll talk about all of the questions that you have, throw them in the link. We will make sure that we get, it's going to be a fun and dynamic conversation. We'll wrap up shortly at 11 and send you on your way. You'll have additional information, other resources that will come to you afterwards. You don't need to do anything about that. It will automatically come to you. There's a quick event evaluation. We really appreciate that as well. I want to acknowledge the Public Health Agency of Canada, who has been working with us both in terms of CANH as well as 19-0 in a number of different ways, but we're very pleased to provide this as a kickoff on healthy conversations about preventive health, vaccinations, and aging across the life course. So a special help to the Public Health Agency of Canada. And you can talk about people who are tired. I tell you, those people have been working, as they always have, at full throttle, but particularly in the last of these 2 years. So with no further ado, I am going to start us off and welcome a real and profound leader in this space. Josephine Pon was elected to the Legislative Assembly of Alberta in 2019 as the MLA for Calgary-Bennington, and she was appointed Alberta's Minister for Seniors and Housing on April 30th, 2019. That was a day that I reached out to Minister Pon and said, thank you for your leadership, because she has been actively committed to this work for many, many years. And you know, when you're getting a minister appointed who's passionate about an area, who is committed to an area, who brings her whole self to an area. And as soon as Minister Pon was appointed, the fireworks went off, because we knew that we would have not just a leader in Alberta, but a leader in Canada. She comes from a background in banking, and of course, she has worked within that health and financial sector. And I said health and financial sector on purpose, because Minister Pon has spoken many times about the intersection of health and financial wellness. And that holistic attitude has been what she has brought to the Assembly, and that has been in her leadership. You can't just think of things in one isolated incident. We need to think about the whole person. And that's why, while we are, of course, talking about vaccines and vaccinations as a part of it, we're talking about the whole person as we are aging in Alberta, and for that matter, aging across Canada. So her work there has been critically important. She's also had a good background in housing, which she's brought to it. Housing, of course, being a primary conversation we're having in this country, particularly when we're seeing inflation rates go up, consumer price index go up, and people are saying, well, how is housing related to health? And of course, Minister Pon will be the first person to say, you cannot have health unless you have housing, and you cannot have housing unless you have health. And those pieces are absolutely interacted. Her work has not just been in business sector and not just been in the government sector, but she has been incredibly active and enormously generous with her time in volunteering. She's been involved in not-for-profit organizations in Calgary and Edmonton, as well as throughout Canada in her reach. She was also a critically important member. And I remember when this came out, the mayor's task force to eliminate poverty in Edmonton, that was a turning point in that city. It made a huge difference in the planning. And again, she brought that holistic role. She's also paid a lot of attention to how Canadians age differently and how participate differently. And that richness and multiculturalism has been absolutely integrated in her work. She was the board chair of the Immigrant Services of Calgary. She was chair of the ISE Immigrants of Distinction Award Gala. She was the vice president of the Hong Kong Canada Business Association and a cultural advisor to the Glenbow Museum. When Minister Pon agreed to take this mantle, we knew that we were in good hands. And so this is just a wonderful opportunity. She's so generous with her time. So at this point, we have a minister committed to housing, committed to health, committed to holistic well-being, and combined with 19 to 0 and the Public Health Agency of Canada, it is my personal delight to introduce to you Minister Pon for her opening remarks. Minister, over to you.
Thank you so much. Good morning, everyone. Thank you, Laura. That introduction is one of a kind and one of the best ever in my whole life, and that kind of the full of energy and a great layout of my history. So thank you so much. And also that posted some of the important questions that we will discuss today. So first of all, on behalf of the Premier Jason Kenney and my government colleagues, it's my great pleasure to join you for the first events in the CANH Healthy Aging Conventions series. Taking care of yourself and taking advantage of a preventive strategy and available support is going to help you age successfully. And I'm excited to be able to talk with you about the Alberta's support for older adults. Well, overall, Alberta is a younger province, and the number of seniors is on the rise. So currently, there are about 705,000 Albertans aged 65 and over. However, by 2035, that number will be more than 1 million. So as a population growth is all the more important to make sure the seniors are supported in their community. So let's talk a little bit about the budget, okay? So earlier this year, Alberta's government presented budget 2022. So it moved Alberta's forward by strengthening our healthcare system and getting more Albertans working and bringing our finance back into the black. So we have a balanced budget. So this prudent financial management allow us to help and ensure that seniors have the support they need to age in their chosen community. Alberta's government provides more than $8.6 billion in service and support to Alberta's seniors each year. We provide financial support and health benefit, as well as the housing and health support for seniors with low income. So in budget 2022, we are maintaining seniors' benefits for those most in need and ensure that vulnerable seniors can count on a stable source of income. Alberta's financial support for seniors are a major reason why we have the lowest seniors poverty rate in Canada. I know the last few years have been tough, and I want to ensure you will be continue to support senior and those at risk throughout the COVID-19 pandemic. Since the pandemic started, we have assisted designated supported living facilities and the seniors lodges to keep the residents of these facilities safer and healthier during the pandemic. That include the funding to the additional staffing, cleaning supplies, and PPE. And we will continue to ensure they have the appropriate support and resource that they need. Health supports are very important. So our COVID-19 and influencers are among the most commonly known preventable disease. There are many other older adults and need protections from. So immunizations is a lifetime process. More information can be found in immunizealberta.ca. And of course, the pandemic has changed the way we live. And older people now have a better access to service that enable them to stay at home longer, like a grocery delivery, and mail kits, or other essentials item. The downside, unfortunately, is isolations. And we know that during pandemic, it is hard for some of the senior, they have been isolated. We need to be mindful of this and take care of the senior in our communities. Maintaining in-person connections is vital for mental health as we age. We all have a role in promoting and encouraging these connections, whether they be in persons or online, as individual or in groups. As the commercial said, always, just do it, because our mental health is just as important as the physical health. I'm always want to talk about elder abuse. That's very important. That's very important throughout the last several years. Alberta's government has put the spotlight on elder abuse prevention. Thank you to those input from the stakeholders and the public. And we are proposing to update the definition of the elder abuse to provide consistency across the province. We are also working with the partners to raise awareness of elder abuse, to provide training or education to groups who work with the seniors, and to provide how we respond to this compact and important issue. Early in the pandemic, in May 2020, Alberta's government worked with our community partner to launch a collaborative online resource and education, the short name is CORE. And as some of you probably hear that, it's an Alberta Online Knowledgeable Hub. This online hub provides organizations with information, resource and discussions groups, and opportunity for collaborations on topics related to seniors service. You will learn more about it later this morning. We also continue to find a new way to reduce the red tape and make it easier for seniors to access the support they need. Moving forward, we will continue to partner with this incredible community groups and other seniors serving organizations to support older Albertans as they need. Even like this, conversations series are very, very important for shining the light on the issues and the concern facing the older adults. Today will be an excellent day of learning and exploring issues affecting seniors' health and well-being. Thank you to CANH for the good work you do to advance the right and the well-being of older Canadians. By working together and learning from one another, we can help and ensure every one of us has an opportunity to be healthy and happy as we get older. Thank you, everyone, and have a fantastic sessions.
Thank you, Minister Pond. That was exactly the kickoff that we needed today to set us going. And again, I just want to thank you because you always make time for community groups and senior serving organizations, and that clear ability to connect with you and your office. We know that action will be taken, and we know that vaccinations are very near and dear to your heart. So we're going to be at you because we know there's an opportunity perhaps for us to develop even more coverage for vaccinations, things like shingles, pneumonia, and influenza. Yes. And we know that you're listening, and that makes a huge difference for us. So we thank you for your time and wish you all the well today. I appreciate your energy today and your commitment to this work. Thank you, Minister. At this point, we're excited to introduce a little bit about what the rest of our agenda is today. So as we are rolling in, I'm so pleased to invite to the screen my colleague, Dr. Jia Hu. And Jia Hu and I have been working together very commonly in the last couple of years. And John wears a number of different hats. So I'm going to spend a little bit more time talking about his work when we're having our active and fun conversation today. But just to give you a little teaser of some of the work that he has been doing, he wears many hats. But one of the hats that he's wearing is CEO of 19 to 0, which I'm going to invite him to talk a little bit about just as he's starting to introduce Karen today. He's also the former medical officer of health with Alberta Health Services, where he was, of course, responsible for vaccines, trying to figure out how COVID and long-term care and continuing care in Alberta are connected, and more. He also is working with the Cleveland Clinic and works as a professor as well. Many, many hats, and we'll talk a little bit more deeply about that today. But at this point, I'm so pleased to introduce Dr. Hu, and he's going to take over this session and introduce to you Karen Sullivan. Over to you, Jia and Karen.
Thanks so much for the quick introduction. You're very good at introducing people. And thanks everybody for joining us on this hopefully sunny Monday morning. So our first session is going to be delivered by Karen Sullivan on basically vaccinations and everything you need to know about them. It's a real pleasure for me to introduce Karen. So I mean, Karen is somebody that I also worked with a lot during the last 2.5, 3 years. She and I spent a lot of time trying to make sure that people had access to COVID vaccines, and pharmacies played such a critical role in that. And I mean, behind the scenes, there was a huge amount of, I feel like my life and the life of people would be much worse off if Karen had been there fixing things on the pharmacy side. So more formally, she's a senior director of pharmacy professional affairs for Western Canada with Shoppers Drug Mart, and has many, many, many other things about her. But, it's she knows everything you need to know about vaccines. She was instrumental to the COVID response and has moved forward into a sort of new-ish normal. She's going to be such a key champion and partner when it comes to getting other vaccines and even other health conditions sort of addressed in the pharmacy setting. And so it's my absolute pleasure to introduce her. Karen, why don't you take it away? You're on mute, I think.
I am. I didn't want to interrupt you. So thank you very much, Shaw, for the very kind introduction. I appreciate it. And as you said, Shaw, you were very instrumental yourself in ensuring the rollout of the COVID vaccine. And for everyone on the the webinar, it was indeed a wild ride, particularly, through the first half of 2021, as we rolled out vaccinations and dealt with things that had never been dealt with before, like a frozen vaccine that had to be maintained at ultra low temperatures to ensure that stability. And we managed it and we did it. And, happy to say so far in Alberta, 8.6 million doses of COVID vaccine have been administered across the province to Albertans. And more importantly, of those 8.6 million, 4.5 million doses have been administered through pharmacies, which is massive. And that's kind of why I'm here, is to tell you a bit about, why vaccines are still important, what you need to get as an adult, and why you should talk to your pharmacist about it. Just to kind of reinforce that, Alberta, there was 1.2 million flu vaccines delivered this year. Of those, 900,000 were delivered through pharmacies as well. So as you can see, pharmacies really have become the locus for vaccinations in the province. And that really has happened nationally as well. And fortunately, the COVID pandemic has moved things along more quickly in a lot of regards in terms of access through your pharmacies. But, just stepping back a second and talking about vaccinations and, why we're talking about it as adults. I know vaccines are one of those things that they are really important from cradle to grave. And we're really good about making sure our kids get the vaccines. And, as new mothers, as I was once upon a time, and I'm sure many on the call were once upon a time, we were really diligent about making sure we did those well baby visits and got our kids vaccinated, from birth through until preschool. And then, once they were in school, public health took over a lot of the reminders on that and made sure we were kept on track. And so the system provided a lot of support to make sure that we were getting those vaccines as we needed them and on time. And then, we hit adulthood and we're kind of left to our own devices to make sure that we continue to get the vaccines that we need, because immunity isn't necessarily lifelong with all vaccines. There's certain vaccines that you do need to get boosters, and some are more frequent than the other. For example, with flu shots, we know we need to get those every year because the immunity doesn't last as long as it does with certain other vaccines that maybe we only need to get in childhood and we don't need to have boosted later on in life. And with the COVID vaccine, because I saw one question in the chat asking what the value of a fourth dose, what we've seen so far is we know that immunity with the COVID vaccinations doesn't seem to last even as long as it does with flu. And we're seeing immunity waning, 4 to 6 months after the last dose. So it is important to make sure we're keeping up with those. And what we see, with adults is a bit of a disconnect in terms of what we perceive as our the extent to which we have kept up to date with our immunizations versus what reality is. So just to give you some poll numbers, in one poll, 88% of adults they asked believe they were up to date with their vaccinations, but in reality, only 3% of those folks had actually received the correct number of vaccines for their age and their risk group. And what that means is, just to talk about some of the regular vaccines we need, only 10% of adults have received a booster and are up to date with their tetanus, diphtheria, acellular pertussis vaccines. That's a pretty low number. It's a little bit higher with other vaccinations. 58% of adults 65 and over are up to date with their pneumococcal vaccine, and 28% of adults 65 and older are up to date with their shingles. But it's still not as high as we need it to be. And, and that speaks to why vaccines are important and why as adults we need to ensure that we're continuing to get them. As I mentioned, they don't provide lifelong immunity, and that immunity is important not just for ourselves as individuals to make sure we keep ourselves healthy and don't get sick, but it's also a social responsibility in ensuring that we don't get others sick, because there's some vaccines like flu and COVID where it is really important that we have a critical mass of individuals who are vaccinated so that we protect each other and prevent the spread of those diseases. And that's a little different than a vaccine like a shingles vaccine, which is about individual immunity. So making sure that you keep yourself well, because you're not going to transmit that to anyone else with that particular virus. So, other reasons why it's important to get them is some of the vaccines that we got in childhood. So not every adult may have gotten all the vaccines that they required in childhood. And that happens if you perhaps have immigrated from a different country where vaccine schedules are different, or access to healthcare was a little bit different, or you might have even gotten missed during childhood. So it's important to check up and find your records and see if you need to get additional vaccines. There's also new vaccines that have come along in recent years. For example, I mean, shingles is still a relatively new vaccine, Shingrix even newer. So those things weren't available previously. And you also need vaccine if you're traveling to other countries. So that's an important one to check into as well, to make sure you've got everything you need if you're going to be at risk. And then there's certain things lifestyle-wise that change, right? As we get older, our living situation may change. Where we may have lived for years in our own home, we may now find ourselves living in a congregate living facility if we've chosen to live in a seniors community, or if we need a little extra support and perhaps are in an assisted living or long-term care facility. And that changes your risk in terms of exposure to communicable diseases and what you may need from a vaccination perspective. There's also certain jobs and roles that increase the risk for individuals too. As you can appreciate, a healthcare worker is exposed to additional risks that your average person may not be, so they have different needs. And believe it or not, even folks like individuals who work in, say, the oil sands camps up north need additional protection too, because again, they're in a congregate living setting while they're on site, which changes their risk factors. The other thing that's really important to realize as well is as we get older, our immune system just doesn't work as well as it did when we were younger. So because of that, our immune system needs a little bit of extra support from the vaccines. So once you hit 50, your immune system, starts to not be as effective or as strong as it was. The other thing that factors into it as well is comorbidities. And it's just one of those things that happen as you get older. You start getting other illnesses or other chronic conditions that can affect your ability to fight off disease. So that's what makes it really important to ensure that we're up to date. And so, I mean, what is it we need to have? Well, every year we need to be getting the influenza vaccine, and that vaccine will differ every year, right? So what happens is we'll look at what's going on in the Southern Hemisphere, and based on what we see in terms of the strains of flu that are transmitting down there, the vaccine will be developed to try and predict what we'll see in terms of strains in the Northern Hemisphere, so that we can hopefully be as effective as possible in preventing illness. COVID is another one that looks like it will be here for the foreseeable future at least, and it's looking like it may be every 6 months to a year, depending on what we learn about the virus as time goes on, in addition to what we already know. Tetanus, diphtheria, acellular pertussis is something that should happen every 10 years. It's something right now that pregnant women will get every time they're pregnant, but then as an adult on an ongoing basis, you should be getting a booster every 10 years. Pneumococcal vaccine is another one as well. There are 2 different pneumococcal vaccines, one called Prevnar 13, one called Pneumovax 23. Pneumovax 23 is the one that is publicly funded and recommended for everyone over 65. Recently, the National Association for Communicable Diseases, they've recommended that it should be the Prevnar 13 should also be given to competent people over 65, but on an individual basis. So that's something you should discuss with your pharmacist if Prevnar 13 would be a good choice for you as well, to have in addition to the Pneumovax 23 for that additional protection. If you are immunocompromised, you really should be getting both. The Prevnar, however, is not something that's publicly funded at this time. And again, shingles is the other one that you should be getting if you are over 65 for sure, but generally it is recommended if you're over 50 to get that vaccine. Not publicly funded, but it is available from your pharmacies as well. So those are kind of the big ones that you should be making sure of. If you haven't had it before, whether for travel or for other reasons, I mean, hepatitis B is one that you should make sure you're up to date with as well. And so those, like I said, those are the big ones. And why should you talk to a pharmacist about it? Well, I mentioned earlier that there were certain things that COVID happened to move along. And your pharmacist does have access to your immunization records. So if you're not set up with My Health Records Alberta and you're not, that savvy and on the internet, your pharmacist can help in that regard. You can go in and they can take a look at your immunization records that are on Imari, and they can help you find out if you're up to date on stuff, or if your risk factors have changed or lifestyle issues have changed that might mean that other vaccines would be appropriate for you. And then they can set a plan with you on those immunizations. And I noticed a question about what does competent mean? Well, immunocompetent means basically that your immune system is there, it's effective, it's working, and you should have a lot of what you need to fight off diseases, but you still need the extra help from vaccines to make sure you don't get sick. So that, like I said, and as I've mentioned earlier, pharmacists, they are basically the largest immunization provider in the province right now in terms of what they do volume-wise. And so they're there to help, and they're accessible. So they're open. Most of them are open 7 days a week in extended hours, and they're able to immunize anyone 5 and over. And I think everyone on the call is probably over 5, so that age limitation isn't an issue. And like I said, I think that's kind of wraps up everything I had to say on it. But I think, like I said, check with your pharmacist. If you do run any of the seniors groups or associations, they can also come to you. So they do a lot of outreach. So you will see, pharmacists providing vaccinations, in assisted living or long-term care facilities. They will also come out if you talk to them to do vaccinations in senior centers. That's predominantly for, flu vaccine and for some COVID vaccine clinics and things like that. And currently in pharmacies, what is available with respect to publicly funded vaccines are the COVID vaccines, influenza vaccines, and the pneumococcal 23 vaccine. Right now, pharmacies do have the DTaP available, but that's they're only allowed to immunize pregnant women. So unfortunately, we can't do publicly funded tetanus diphtheria boosters for all adults in the province, but we're hoping that sometime in the near future, that will be expanded so that you'll be able to access that to pharmacies. But right now, you will have to attend to a public health unit and book an appointment to get that vaccine if you're not up to date. So, like I said, I think that's all I have to say, and I'll turn it back over to you, Jean and Laura. And if anyone has any questions, happy to entertain them.
Thank you so much.
Oh,
go ahead.
No, go ahead, Laura. I was going to say we should, if people have questions, I see there's a whole range of questions on COVID things, income thresholds, long-term care. But I think if people have any questions about some of any vaccines, I think Karen would be happy to answer. And so,
We do. Let me feed you some questions. How about this? So Tammy is asking you, Karen, do you think that we could have the COVID vaccine merged? And I think by merged, she means co-administered by the annual flu vaccine. NACI has come out with some recommendations that they can be co-administered. What are your thoughts from that point of distribution, Comac? So that's the question that Tammy has today.
Yeah, so right now, Laura, like you said, you can co-administer both of the vaccinations. And in terms of timing of the vaccines, I think it will all depend, right? I mean, right now, the current recommendations from NACI are anyone 70 and older is eligible for a 4th dose of COVID. And I think over time, we will probably see the timing similar. We may or may not, though, right? Flu, we know, is annual, depending on what immunity looks like with the COVID vaccine. If it's something that's recommended every 6 months, then we may never get that, I guess, merge, if you will. But like I said, they certainly can be administered at the same time. So if somebody, if the timing works out where both are in season, if you will, the ability to administer both at the same time is definitely there, as well as with the pneumococcal vaccine, right? If an individual hasn't gotten their pneumococcal yet.
I think, co-administration is magic. Wherever we can, you're rolling up your sleeve anyway, you're already there. One of the pieces I just wanted to ask you to pull back the curtain a little bit. We've all frankly been a little bit in awe of how pharmacists have stepped up. Now, pharmacists are always the center of community health hubs. We know how critically important that is, particularly even in rural communities where they may really be that central health provider in so many ways. Karen, can you share with us, pull that curtain back a little bit? If you had a wish list, if there's lessons learned coming out of this that we want to make sure that we move forward on, as opposed to kind of going backwards, what would you have us know about what lessons have been learned and what we don't want to slip away from in terms of pharmacies for this type of preventive health conversation?
Wow, that's a lot. That's a lot to unpack. I think, if anything, what the whole COVID vaccine rollout has demonstrated is how important it is, to leverage pharmacies and pharmacists in massive campaigns like that, because like you said, pharmacies are in every community, and they do have one thing that pharmacies do have that's really unbeatable is access, and they're able to do it. I mean, that's a tough question to answer, right? Because I think for so many years with the flu vaccine campaign, I think so many things have been done so very well with that. And, with the COVID vaccine, we had a lot of hiccups initially, simply because of, like I said, the challenges with the storage of the vaccine and transport of it. It was unlike anything that had ever been dealt with before. No one had ever dealt with a vaccine that had to be maintained from minus 60 to minus 80 degrees and how to manage that, right? And then once it was thawed, you had 7 days to use what was in your fridge, but then once you opened the vial, you had 6 hours to use what was in the vial. So it really made logistics and coordinating, making sure you had enough people to put needles in arms present to use it, so you weren't, wasting any of it. And because, wow, that stuff was worth more than gold when it first came out, right? It was very much under the microscope with respect to ensuring that it wasn't wasted, and that every dose went into an arm to ensure that we could navigate through the pandemic and get to the point where we're at now, where we've got folks that have some form of immunity, so that they're not getting as severe disease from the COVID. So I don't know if I really answered your question or not on that, but it's a tough one, because I think, like I said, I think we've learned a lot, and I think if anything, we've learned that it is really important to make sure that pharmacies are part of it, because there is a lot of capacity there, and they have access, and they're very convenient. And the reality of it is, when we've taken polls and asked folks where they would prefer to get their vaccines, overwhelmingly they want to get them in pharmacies, and it's for those reasons, right? It's because it's convenient, it's close to home, and it's easy.
Yeah, and that is the place that people also have that trust relationship. They're coming in and out. It has that ability to have that important conversation. And I think the relationship between the pharmacist and the client at this point is often the closest relationship. I mean, just trying to get to your doctor, particularly in the last 2 years, but even so, the doctors are saying time and time again, look, this is something that's best done in the community. Like, for some people, okay, we can come in and do a number of things and also get your vaccine, but this is a piece that can be done, and we've been so grateful. Dr. Hu, over to you. Questions for Karen?
Yeah, I've just been scanning, and I totally agree with that. I'm also a family doctor, but I mean, I really do think we kind of got to have everybody on board, whether you're a nurse, a family doctor, a specialist, or a pharmacist, doing as much as we can to get access to vaccines and knowing their patients well. So completely agree. We're going to, oh, there we go. I was going to talk about pneumococcal because there was a question, and now there's a second question. So the question around pneumococcal vaccines, the pneumonia vaccine, and this one can be very confusing. Is the pneumonia vaccine an annual one? So Karen, could you speak to a bit more about the pneumonia vaccine and how it's given and what people need? It's very.
I was going to say, you can feel free to jump in on that.
Oh, I know I could, but I'll answer the COVID questions down the line. There's a lot of these like COVID behavioral ones.
So no, it's not an annual vaccine. You get it once, and that's all you need to get that vaccine. It is generally recommended that the pneumococcal 13, the Prevnar, is given a year prior to the Pneumovax 23. So the Pneumovax 23 or the pneumococcal 23. The reason they're different vaccines is because there's, I guess if you want to call them different strains of the pneumococcal bacteria, it gives you broader coverage of all of those different strains. And that's why. And generally, I mean, Prevnar 13 is usually what we see given in childhood, but now it's also given concurrently with, or spaced, I guess, not concurrent, spaced with the Pneumovax 23. And I don't know, Jock, if there's anything you want to add to that?
No, it's that. No, that's really good. That's perfect. I mean, so there's 2 vaccines you're supposed to get. You only need them once. Just one thing that's been really neat about COVID, though this is probably happening before COVID, is there's a lot of new vaccines coming down the pipeline, actually. So, Karen's been referring to this thing called like Prevnar 13, which covered 13 strains. There's another vaccine called, PCV 20, which covers 20 strains. It's been approved and in use in the United States, actually, and will be approved in Canada actually next month, we think. And that sort of is just, there's a lot of new stuff down the pipeline that I think, everybody, it's a lot of seniors should get. And so very exciting time for the vaccine world. All right, we have another pneumococcal question. Well, this one's linked to a shingles question, actually. But Karen, do we need prescriptions for the shingles vaccine or the pneumococcal vaccines?
So you do not need prescriptions for either, actually, and I will qualify that with the shingles, though. So pneumococcal 23, no, you do not need a prescription for. For shingles, there's 2 types of vaccines. So there's one that's a live vaccine and one that's a non-live vaccine. So currently, you do need a prescription for the live vaccine. You don't need a prescription for the non-live. So the non-live is also known as Shingrix, and that's the one that's most commonly used today. I'd be surprised if you actually were offered the live vaccine anymore. So for both of those, no, you don't. But if you're in Alberta, even if you did, most pharmacists have something called additional prescribing authorization. And if they have that, they have the ability to prescribe for those vaccines.
That's awesome. And you know what, just on that topic, because I'm kind of curious, and I think a lot of people might be, what does additional prescribing authority, because this is quite unique to Alberta, I think, compared to other provinces, let your pharmacist do for you, that's helpful.
So what it does, it is, as John mentioned, it is broader than any other province. What it does is it enables a pharmacist to prescribe for any Schedule 1 drug. So what is a Schedule 1 drug? Well, that's any prescription drug. So that excludes, though, narcotics and controlled substances. And the unique thing about the way Alberta has approached it is that it's what we call self-limiting from a regulatory perspective. So the only restriction on what a pharmacist can prescribe is based on their own individual competency. So they're only allowed to prescribe within areas that they have the competency for, and the knowledge and the education to prescribe for. So it does mean, like I said, they can prescribe for a number of vaccines. So if you're traveling anywhere and the vaccine requires a prescription, if they have APA, they can do that. It also means that if you have any kind of minor self-limiting illnesses, they can prescribe for that. So say you have something like, I'll use an example of pink eye. That's something that they would be able to prescribe an eye drop for you if you go in and see them and they do an assessment. Or urinary tract infections is another one that is very common that pharmacists will see and they can prescribe for. So and they can also extend your prescriptions for you as well. If you find you're running out and you need something, or maybe you're in one of those folks that's in a position where your family doc has retired and you're still trying to find a new family doc, or it's a few weeks between when you can get in to get that appointment. So it gives you the ability to access additional services from the pharmacists in that regard.
Perfect. So you go to your pharmacist, you can get lots of things there. Okay, we're going to go back to other vaccines. Influenza vaccines are also one that are both simple in the sense that you should get one every year, but also very complicated because there are a lot of vaccines out there. And so the question is, around, can you speak to high dose vaccine, which is national advisory immunization for those 65?
Sure. So there's actually a couple things to be aware of, right? Is there's sometimes we'll see a bivalent flu vaccine and sometimes we'll see a quadrivalent. What that means with a bivalent is it'll have basically two different strains efficacy against two different strains of flu virus. The quadrivalent will have 4. The high dose, they actually use a bit of an adjunct in it to increase the amount of antigen you're getting. To increase your immune response to it. And it's generally recommended for folks that are, like I said, over 65, because your immune system isn't as strong as it is when you're younger. So it needs a little bit of help to get as much of an immune response as possible. And I don't know, John, if you may want to add to that.
Yeah. So, I mean, flu can be kind of confusing in the sense that, there's so many vaccines available. The high dose vaccine the person Ken is asking about was shown in a randomized controlled trial. Those are the sort of studies we use, the best level of evidence. All the COVID vaccines had those, showing that it was superior in terms of preventing both flu and hospitalizations in seniors. And so it is sort of probably a better vaccine than the one I would get, because I'm not a senior. And so there's also, a lot more sort of flu vaccines out there coming out in the same way there's a lot of pneumococcal vaccines coming out. And so, I think it's really important, especially if you're a bit older, that you get a flu vaccine. It's been interesting because during the last 2 years, we've seen almost no flu because our sort of restrictions with COVID that really limited social interaction put a stop to a lot of sort of common infectious diseases. But I was actually just talking to the lab on Friday, and we're actually beginning to see a wave of influenza in Alberta, which, I think is a harbinger of the fact that we're seeing each other again, which is actually good. We need to see each other again for a host of reasons. But I think it'll be really, really important that this coming flu season, and when the fall arrives, for people to get those vaccines, because I really can't see us going into a lockdown. And Ken is also saying, yes, the high dose it's got 4 times the stuff, like the flu virus antigen in it. And that's especially important for older people because of term immunosenescence, which Karen was alluding to, which is the fact that the older you get, the sort of the weaker your immune system becomes, at least in generating a response to some vaccines. And so it's a good one. It's a good vaccine. And sadly, our uptake is for flu vaccine is some of the lowest of any vaccine out there.
Well, what I will add too, with respect to high dose vaccine, Alberta actually is the only province in Canada that makes high dose vaccine, publicly funded high dose vaccine, available to all seniors 65 and older, regardless of where they live. In every other province, it's generally restricted to those who live in long-term care or congregate living settings. So just something to be aware of is that it is more broadly accessible as publicly funded vaccine in Alberta.
Yeah, which is, so everybody certainly should get this. I mean, flu and pneumonia, one of the top 10 leading causes of death in Canada. I think people like know this because they think it's kind of like a cold, but it can really kill you, actually, amongst other things. And so get your vaccines. All right, let me just see. Oh yes, in Canada, it's also 65 plus covered in Ontario, Yukon, New Brunswick. So for those in those other provinces, it is covered in a lot of places now. Okay, we have another question from Maria around pneumococcal. I was told that pneumococcal vaccine was only good for 5 years, the polysaccharide one. Do you want to take that, Karen, or do you want me to take that?
You go right ahead.
Yeah. So the pneumococcal, pneumonia vaccines can be quite complicated. So most people only need it once. Some people will get a booster 5 years later, depending on sort of your medical conditions. And so I think that's kind of where you heard it from. But it's not like an every 5-year vaccine. And so like many family doctors call me with this, and so the question you have is a very common question, and so it's really, you may get it twice. I mean, very few people get it 3 times, but for your average like healthy senior, like somebody who gets it when they're 65, they only need it once. And then there's the uncovered Prevnar 13, which is really good, like recommended but not covered, which is a thing we're seeing more and more in the vaccine landscape. Also sort of recommended for everybody over 65. So I hope that answered your question. Laura, how much time do we have?
We have time for one more question. Why don't we do that?
Okay. Does anybody have any? I'm going through the live Q&A, but as I do that, does anybody have any?
I have one, of course, because that's it. So
amazing.
Karen, one of the great opportunities and challenges I think we have is, who can give what. And we talked a little bit about that before when it came to who could cover it. One of the things that we are increasingly challenged by is when there has to be additional costs associated. So if you, for instance, you go to your doctor's office, you don't have to pay a fee, but sometimes there can be additional fees. And maybe you could just clarify what it is in Alberta so that people know what they're getting into when they go to the pharmacy for different vaccines.
Sure, happy to do so. So if it's a publicly funded vaccine, it's fully covered. So the cost of the vaccine is covered, as well as the cost to administer the vaccine is fully covered. If it's not a publicly funded vaccine, you would be responsible to pay the cost of the vaccine unless you have some other private drug insurance plan that will cover the cost of the vaccine. And then the cost to administer that vaccine would be out of pocket as well. It wouldn't be covered. So basically the way benefits are structured in terms of what is and what isn't covered, if it needs to be administered by injection in a pharmacy, whether it's a vaccine or whether it is a drug that might need to be administered by injection, that injection fee is covered if it's a publicly funded vaccine, or if the medication is a benefit on the Alberta drug benefit list for seniors. So that's kind of the rule of thumb to determine if the cost to administer will be covered or if it'll be something that you would have to pay.
Thank you. That's perfect. That's wonderful. We are thrilled to have had your very precious time. And again, I want to thank both of you for taking the time out today. I want to share in particular that, Shoppers Drug Mart's the one just down the street that we send our kids to. And I think of it often as a one store idea, but really, I think it's so important for people to realize that this is a highly, highly both centralized and localized connection that we've had to do in terms of ordering and distribution. And then an extra big thank you to all of our pharmacists out there who have been also filling out all of the other prescriptions, also providing preventative health information and support, helping people with acute care, and at the same time, trying to get both the regular vaccines going at the same time as COVID-19. And we know that we're very much in their debt. And Karen, thank you for your wealth of experience. All right.
Thank you for the invitation. Pleasure to be.
Thank you so much, everyone. All right, we're going to just move now to a quick 5-minute break. We know that it's time to grab a cup of coffee, powder your nose, answer the door for the Amazon guy, and let the dog out. So we will be back in 5 minutes. Just feel free to stay on. You can leave your camera off and your sound off. Give you 5 minutes to do that, and we're going to come back with the next part of our great session. Really looking forward to it. Feel free to stay on and chat, or feel free to grab that cup of coffee. Back in 5. Going to come right back. Welcome, everybody. And it is, of course, National Immunization Awareness Week, which is one of the reasons we're having this important conversation today. As we move into the next session, I just wanted to make sure that we again acknowledge the Public Health Agency of Canada and the great work that they've been doing. Speaking of people who've been busy over the last little while, they certainly have been. This next session is going to be an opportunity for Dr. Hu and I to have a bit of back and forth and answer all your questions. And we're going to do that quite informally in some sections and a bit more formally in others. I am going to have the privilege of introducing Ja, and then he's going to have, I don't know if it's the privilege or not, but he's going to introduce me. We'll see how that goes as well. So many of you will have seen Ja from his work in the Alberta Health Services. He was, of course, part of that key rollout team that was heading up the COVID response. He is the former, of course, medical officer of health with the AHS, the Alberta Health Services. And when you were wondering who was burning the midnight oil, he certainly was. He is currently, in his spare time, the CEO of the not-for-profit organization 19 to 0, and we'll share a little bit more information about the good work of that. Ja, of course, also spends his time donating his time, effort, and expertise, and he was just overseas helping to support the Ukraine situation by being in Poland and helping to provide some of that response. As part of my little quick introduction, I just again want to recognize that the National Immunization Week is this week, and that's part of the reason we're having the conversation today. I'm going to share a little bit more information about CANH after I brace myself for my information, my introduction by Dr. Hu. Over to you, John.
Oh, thank you so much, Laura. Once again, I feel like I have not heard anybody make introductions better than you. So I think everybody on the call probably knows who Laura is. But I mean, I've had the pleasure of working with her over the past couple of years, and she is really like a force of nature when it comes to, advocating for seniors across the spectrum of their needs. I mean, her as the CEO of CANH. She obviously is, a commentator on multiple media platforms on a range of issues affecting older adults. She serves on a number of boards, committees, and panels. She's forged this organization actually very recently, and it's become one of the leading luminary organizations sort of in the senior space. She also, seems to be all over the country and all over the world, which is something I do to a lesser extent than she does. And she's, as a person, incredibly fun and sort of chaotic in a good way, if you can't tell. So just like me. And so with that, I will hand it back to Laura, and she'll do her spiel, and then we'll have a nice little conversation and make sure all the questions that people have put in the box are discussed and answered.
Wonderful. Thanks very much, Michelle. That was great. I just want to introduce 2 seconds about our CANH. We jumped right in with the minister and we jumped right in with Karen, but I wanted to take a little bit of a step back and provide an opportunity for both the organizations to speak a little bit about why we're having this conversation to begin with. So CANH is Canada's National Seniors Organization. We're a nonpartisan, not-for-profit, and we work hard to be the voice of older adults. We are the largest seniors organization across the country by membership and distribution. And we work very, very collaboratively with all of the other organizations. Our head office is at U of T, but no one's been there in years. And I'm happy to say that we have staff teams in BC, Alberta, Ontario, Quebec, Nova Scotia, and until quite recently, Newfoundland. And we're really excited as well about this type of conversation. We are talking a lot about how we advance the rights and well-being of Canadians as we age. And we talked a little bit with Minister Pond about this important idea of connectedness and vibrancy. And we know that preventative health is core to that conversation. Again, it's free to join CANH. This is my little plug here, and same with 19 to 0 as well. So canh.ca/join, please join. It lets us reach out to you. There's no downside. You're not going to get, invitations to buy things. We're not trying to sell you anything. It's just an opportunity for us to be connected and to make sure that your voice counts, and particularly around this National Immunization Awareness Week. I wanted to take the cheekiness of introducing a little bit our partner 19 to 0, which Joe, of course, is the founder and CEO, and he has launched it in August of 2020. It's not like he wasn't doing anything else that time, I promise you, but has really brought together a wonderful confluence of groups and organizations to make enormous impact in community outreach, and it has become a really go-to organization. We're so pleased to be working with them on this, and again, thanks to the Public Health Agency of Canada. When we're thinking about health and preventive health, we talk about these 6 compass points on our roadmap to age inclusivity. Obviously, we're talking about the I, infection prevention and disaster response, but really there's an intersection for all of these pieces as well. So I am just with a breeze going to pop through some of the issues. We heard Minister Pond talk about elder abuse awareness and prevention, and we know, just to give you a sense, that elder abuse and neglect was about 1 in 6 before COVID-19. As a result of COVID-19 and people being isolated and so forth, we estimate there's about a 250% increase in abuse and neglect in the last 2 years. So it has something to do with it. Health and wellness, of course, that makes a difference. But if we look at how some of these issues have been impacted by COVID-19 about vaccinations and preventive health, we know that the downflow has been hugely impacted. Anyone who's been waiting for a surgery, or even for that matter, rehab or any kind of support, you may have found that your appointments were much farther down the way. I certainly have had that experience myself. We're obviously talking core about vaccine uptake and reform, but really it's about staying well and staying healthy. And how do we make sure that we are improving on what we've learned during COVID-19? And that also means, how do we do it within different housing sectors at home? And one of the big issues, we thought about, in Alberta in particular, was continuing care, but in actual fact, at home was also very concerning as well, because at least in the continuing care, or some people would call it long-term care, or that health and housing continuum, there's usually somebody who's there to help. At home, we saw that people were really isolated, and it's snowy in winter and it's hard to get places as well. And transportation was a key issue. So looking at these intersections, we've already been talking about preventive health and the cost associated with it. One of the big things, and cat's out of the bag, that Dr. Hu and I are both big on, is making sure that all of those NACI recommendations are implemented free of charge. So one of the great questions that we've talked about in the chat here is about shingles. It's a great example. And we know how expensive shingles vaccines are. So Silva asked about that. And Shirley also was asking, she said the shingles vaccine cost her over $200. I'm sure it did. It would cost you about $250. And most people, right, can't afford that, particularly if there's 2 of you or more in there. And we know that, she was saying she had to pay for the pneumococcal vaccine and to get a prescription, to get the tetanus vaccine, and it's got to be more affordable. And I agree with you. Absolutely. So that's really our goal in making the economic affordability. Well, we're talking about social inclusion, and one of the questions that we saw here was about swimming. And, the fact that they can't go, Mary Helen is talking about the fact that, she can't go swimming and she's worried about the social inclusion around that. And it absolutely is the case. So we have been blending together this information by putting together a cross-country report card. And you can see here, Alberta's got a C. It's not that great. We can do a lot better across the country. And let me just show you a little bit about where we are right now in Alberta and why that number and letter was there. So we see here as well that we have a C, and that means that there was an increase because the high dose flu shot was now made available. That was a big win in Alberta, and we really think that that's fantastic. But of course, the shingles, as we're talking about with Shirley, is not funded, and it's very expensive. And we know that one big thing that we can do in Alberta is to fund that NACI recommended shingles vaccine. Shingles is not a joke for anyone who's ever had it. I tell you that. It may not be communicable in an A to B point of view, but it can severely, severely impact your life. And the new vaccine is a really critically important piece. And we know that things are difficult. So you see here, building on the great conversation we had with Karen, we want to ensure that pharmacies and healthcare professionals can get the vaccines that they're requesting. And we need to have more awareness and clarification. Lots and lots of confusion about which vaccines cover us for what, and how long they're available. So again, let's compare Alberta with some of the other jurisdictions. Well, BC was less, but Ontario was more. So the Ontario got a B. It covers, has shingles for people 65 to 70. And that's a big part of the difference that Alberta yet doesn't. Although you see, for instance, the access point was not very good in there, but that is an issue. Yukon also now funding the shingles vaccine, as well as a broader number of vaccines with regards to how it compares against Alberta. And you can see again here how pharmacies and communities are important. PEI, again, also one of the big differences there was that they funded the shingles vaccine in addition. So you can see a real trend, and we're certainly hoping that we can see that including greater funding to make sure that people don't have to pay that incredibly expensive out of pocket for what NACI recommended is an important piece as well. So that's my quick little introduction to CANH. And I hope that, Mary Helen, I hope I validated your concern on that. We'll get back to some of your questions as well. And surely I really hear you when you say it's very difficult. So that's a little bit about why we're having this conversation right now, a little bit about how you can find out more information in the chat. You'll see that. I'm going to turn it over to Dr. Hu right now to introduce a little bit of 19 to 0 and some of the work that he's been doing. And then we're going to have our conversation. We're going to talk a little bit about what do you need to know? When do you need to know it? What shouldn't you pay attention to? Because that's as important as everything else, and where we're going from here. Dr. Hu, over to you.
Thank you so much, Laura. And I won't speak too long because I'd really like to get to the conversation, which will be very fun and informative. But I mean, 19 to 0 really was an organization that was, I started when I was still a medical officer of health. And it was at the time, I think, geared towards trying to get people to, follow COVID restrictions, as well as, to get vaccines, which we knew were coming out pretty darn soon. So that was about a year and a half ago. And since then, I think it's really grown to I call it like an evidence-based health behavior change organization, where we use a variety of approaches, including things like big marketing campaigns, but a lot of it's actually very grassroots. We work with hundreds, if not thousands of community organizations, primarily on COVID, but now we're shifting to many other things, actually. I mean, whether that's sort of routine vaccines like we've talked about a lot on this call, or things like cancer screening or mental health or preventative care in general. And so, we are based in Alberta, but again, we sort of operate across the country. And, as I think about sort of what needs to be done, I'm really glad that COVID is winding down on average, in the sense that our hospitals sort of aren't overrun. We sort of, I think, mostly are getting through this big BA2 wave. But as we look into the future, pretty much every single health indicator has been adversely affected by COVID. I think about things like HPV vaccination, which in provinces like Ontario have fallen from 60, 70% to less than 1% coverage. If I think about things like cancer screening, which a lot of people need to do, again, double-digit declines in people getting things like cervical cancer screening or mammograms, and let alone issues like mental health, which I think were not very well addressed even before the pandemic. And now during the pandemic, because of all the things that sort of happened with restrictions and social isolation, probably should have skyrocketed. And so Alberta, we call this the care deficit. That's the term Alberta Health Services uses. But I mean, I think this is something that every province, every health system, everybody in the community is going to sort of have to address. And so 19-0 will always focus on vaccines, but we're heading more into some of those other issues nowadays. And always happy to sort of educate and support, people in the communities as they sort of navigate these health challenges, whether it's sort of, which pneumococcal vaccine should I get, or something like, how do we get a vaccine that's critically important and recommended covered. So that's my little brief introduction about us. You can visit our website. Laura put it up. But let's, why don't we get to the chit chat?
Let's dig in some good stuff here. All right, I'm going to jump into the chat first and ask you some questions as well. So I'm going to do some of the policy questions, and I'll talk a little bit about that. And Dr. Hu will do some of the more medical questions. But let's start first with Maria, because you did mention the fact that, that the pneumonia stuff can be a bit confusing. So first of all, let me say the pneumonia vaccine is incredibly important. And I think it's one that we don't talk about very much. Now, as Dr. Hu had mentioned, there's a new pneumonia vaccine coming down the pipe, and I hope we're going to get it in Canada. It's been in the US, and it's going to be a great one. But there's confusion. So we've got what we're calling P13 and P23, okay? And Maria says that she was told the P23, the pneumococcal P23 polysaccharide vaccine, was only good for 5 years. And that we heard Karen say you only need one shot. So how are those things together? Can you talk us a little bit more about pneumonia?
Yeah. No, and I think I covered this a little bit with Karen, but I mean, for most people, so really the two types of pneumonia vaccines, one is called a polysaccharide vaccine and one is called a conjugate vaccine. I wish there were like easier ways to, like declutter this medical jargon, but the P23 is the polysaccharide vaccine. And that's good for, when we say pneumonia vaccine, really, what you're protecting against is a bacteria that can cause a bunch of things, including pneumonia, but also meningitis and bloodstream infection. And so that P23 vaccine protects against this bacteria, but isn't particularly good for actual pneumonia or the lung infection. And it's kind of good for the other things like meningitis and bloodstream infection. And so that's something, seniors, when you turn 65, everybody is supposed to get one. And then a few people are recommended to get a booster 5 years later, but many people don't. And so that's kind of where I think you don't need it every 5 years. On average, I think about 60 to 70% of people have this. So it's quite a bit lower than the childhood vaccines. And so everybody should get this. This is a publicly funded vaccine for seniors. The other vaccine, which is called the conjugate one, so this is Prevnar 13. Now that actually is good at protecting you against pneumonia, like a lung infection caused by this bacteria. Unfortunately, and this is where, a lot of the advocacy work that Laura and I do sort of comes into play. I think everybody knows what NACI is, but they're sort of the technical body that makes recommendations on vaccine use for the country. And they basically said that everybody over 65 should get this conjugate vaccine that protects you against pneumonia, but it's not covered. And they've also sort of said it shouldn't be covered, which it's kind of strange, actually. There's a few things about this. The sort of same thing applies to what used high dose influenza, where NACI was saying everybody should get high dose influenza individually, but when it comes to a public program, people can get whatever they want. And so this is one that you sort of have to pay out of pocket for if you have insurance pay for that. But I do think that a lot of these things are going to hopefully change around pneumonia in the next year or two. And that is because actually of this new vaccine that's sort of come out, this PCV, like it's conjugate with 20. So Prevnar, we call it 20. And so it provides you much broader protection. And it's already been used in the United States for, I don't know for how long, but it's been used there. And, all of the data the United States used showed that it was not just cost effective, which is a thing we use in medicine to say, like, if we can extend your life by spending $20,000, it's worth doing by a year. Like, this is cost savings, which means if we give this to you, it'll save money from the healthcare system entirely. And so I'm sort of optimistic, but, this is kind of where we need to, do a lot of advocacy around getting these really important things covered. And nothing, it's nice to have people like me, like a doctor, talk to the government, but I think they really listen to people like you, actually people from the community, more than they listen to people like me. And so that's the quick rundown on pneumonia vaccines. It can be a little bit confusing, but I hope that wasn't too confusing as an explanation.
It's perfect. And I've just put here for folks want to know who's covering what, how, when, and who. Just click on that link there about our vaccine report card, because you can double check. We have listed what's covered in every jurisdiction in the country and without a barrier. That doesn't say things you can buy yourself. This is covering what is covered publicly. So it's a great place to do it. Now, there's a bunch of questions here about shingles, Dr. Hu, and let me give you a couple of them because I think you can answer them a little bit at the same time. So one of the questions that's kind of is, hey, I've had chickenpox. Do I still need a shingles vaccine? So that's one question. Second is, hey, I've had shingles. Do I still need a shingles vaccine? So why don't we do those two together?
Yeah, so everybody, for the first one, the only way you have shingles is if you had chickenpox. It's sort of what chickenpox is it, sorry, my computer is beeping at me for some reason. Anyways, so it's something that you get when the virus that causes chickenpox, which stays in your nervous system, reactivates. And so definitely you should get the vaccine if you've had chickenpox. You should also get the vaccine if you have shingles as well. There's just a bit of a waiting period in between. I don't think, just a quick overview of shingles or the disease itself. I mean, 1 in 3 Canadians get it. That's like a lot of people. And when you have it, it's dreadfully painful, I think, but then, which is debilitating. But then there's this other thing you can get, which is called like post-herpetic neuralgia, which is this chronic condition that can last for years, where you're just living in pain for years. And it's quite hard to treat because it's a type of nerve pain. And I mean, I don't think we're that good at treating pain in general because all of our drugs have all these side effects. And that's especially debilitating. And that is kind of why, NACI, again, recommended quite a long time ago that everybody 50 and older and anybody 50 and younger with immunocompromising conditions should get this shingles vaccine. And, we're beginning to see more coverage across the province. Ontario sort of has been the leader in this, hence the B, I believe, on the report card. But now we're hoping that, because of COVID and how important vaccines, like everybody kind of knows what an antibody is now, and everybody knows a little bit about vaccines, that we can sort of carry the momentum from Ontario and, I think it's PEI and Yukon into some of the other provinces and territories. So, yeah.
And again, if you want to know who's covering what, where, that great report is there. We'll make sure that you also get some of those take-home messages in the follow-up email. Let me jump a little bit on to a question that one of our people have asked about boosters. Okay, Mary Helen is asking, she's getting boosters, but then another different kind of shot comes along, which seems like an improved vaccine. I think she's talking a lot, like we all are, about, well, do I need a third shot? Maybe do I wait for my third shot to be really the fourth shot? How often do I need to get these boosters? Are these boosters important anyway? Dr. Hu, tell us about boosters. Should we get all of them right away as soon as they come out? Should we wait for the next one? What's the best thing to do for COVID?
Yeah, I mean, it's pretty confusing, right? Because, on the one hand, like we can change our recommendations pretty fast. On the other hand, if you look at what happens in other countries, you see different countries having pretty different recommendations on boosters, even different provinces for that matter, actually. So Ontario tends to offer boosters a bit more broadly than the other provinces. And so, when it comes to like my top level message is you should get the vaccine when it's recommended to you. I'll decompose that a little bit. one factor in whether or not I get a booster, why you should get a booster, is the amount of protection that it gives you and how long that protection lasts for. But the other factor, and we sort of count this in when we make some of these recommendations, is just how much COVID there is around, right? So a booster today in Alberta, when there's quite a lot of BA2 Omicron circulating around, is going to give you sort of protection. Would be pretty useful, actually, more helpful than a booster, let's say in the summer, when there's a lot less circulating virus. And this also then feeds into, I know there's all these questions on sort of how one should live and act. But I mean, if you're out and about and there's a lot of cases, you should really, really get a booster. Now, there is this sort of 5-month waiting period, and even that varies by province. Actually, Ontario made it 3 months at some point to get the first booster. But I mean, I think that if I were to take out my crystal ball and predict what's going to happen over the next few months, from a COVID perspective, with this second wave of Omicron, I think we're going to get over it pretty soon. Ontario's already crested, and they were always a bit ahead of Alberta. Western Europe, which is quite interesting, was ahead of Ontario. They have less than no restrictions, and they sort of manage their BA2 sort of wave as well. And as we head into summer, and I feel like all of us got snow on Friday, but it all melted by Saturday or Sunday. And so hopefully that happens less. There's going to be less cases, which means we should be relatively safer than summer, as we always are. By the time fall rolls around, we don't necessarily know what's going to happen, or especially winter. Not fall is usually fine. The one big development to the vaccine front when it comes to COVID is that we're pretty confident that they are going to be Omicron specific vaccines available. I'm going to just say in the fall. But I think that back to the original question, which is, should I get it? Should I wait? I think right now is a great time to get a booster, because we know that, your immunity wanes, and it can wane pretty quickly, especially with the Omicron variant. And there's a hell of a lot of Omicron floating around. And so, that usually is a huge determinant, right? Like if you're in a place like, Australia was for much of COVID, there's not much COVID, so your risk is low. But when you're in a place like Alberta, when there's, I think 8 of my friends got COVID in the last week, actually. It's kind of nutso. So anyways, so that's it. And I want to decompose that a little more, because it can be kind of confusing, because sometimes us in public health give you these recommendations that aren't well explained.
At 9, actually, I just got over it. I have stayed COVID free for the past 2 years, but I finally fell to it. So, add me in that list. Absolutely. Let's talk a little bit about preventive health more broadly. And so you've got a GP hat that you put on with many of your other hats. And I know we're talking about adult vaccinations as one really important part, and we've never talked about vaccines so much in our lives before. Remember, we used to talk about the Calgary Flames or the Edmonton Oilers, or, whoever else was playing who. Now we talk about, Moderna versus Pfizer versus whatever else, right? It's a change of our conversation. I'm really worried. We talked a little bit about comorbidities. I think that a lot of people don't realize, that some of their health conditions are, quote, comorbidities, because we use these fancy words. But so my husband, for instance, has got diabetes, right? He manages it well, but he's also got asthma, and he manages that well. Would he ever think that he has a comorbidity? No, those are just things that he manages in his life. Can you share a little bit about preventive health? And, what do we need to do to keep ourselves healthy and well generally? And then again, in the era of COVID, what does it mean with these other conditions we live with? And how much more important it is to get vaccinated against things?
Yeah, happy to. It's a big question, but I'll try to organize my thinking a little bit. So when it comes to preventative health stuff, I mean, I think there's the stuff you should do outside of seeing your doctor and the stuff you should see your doctor for, right? So when it comes to stuff outside of seeing your doctor, I mean, really, I mean, I'm sure everybody knows this, but, making sure that you exercise, and that can include just walking, really, frankly, right? Semi-regularly. And I know that's been hard during COVID, is really, really critical to your overall health. So I'll put exercise as one of them, including just walking. Another is sort of the food we eat, and God forbid I ate way too much processed food. But the more sort of vegetable-y type things we eat, and the more sort of protein, less fats we eat, often the better. And then one really big thing that I think has been really mucked up by COVID is social connectedness, relationships, friendships, and all that stuff, right? And I think that, you know, taking the time or trying to see people you care about, it is really, really, really critical. And, you know, I think with COVID, that was really hard. And we can speak to this in more detail, but, you know, as you navigate sort of this new COVID world where there's no restrictions, there's quite a lot of COVID, what do I do in terms of seeing people that I really want to see for my mental health, for my social health, for my well-being? And so I think that, like, that is you know, Laura dropped a little fun factor in the chat box that social isolation was about as bad as smoking 15 cigarettes a day, which is like, you know, like 3/4 of a pack. And I mean, it's good for your health. It's also just good for you, period. I think, like, you know, it's part of why we live our lives. So that's sort of a cluster of things. And I just really, you know, pandemic has been so hard on so many people. And I think if I honestly feel like for most people, if I could have them do like 2 things, it'd be like, go see your friends and go for a walk, right? Like, you don't get too complex. But I mean, we usually tell you to do too many things. When it comes to seeing your doctor, I mean, usually there's stuff that everybody needs done. And so by the time you're 40 or 50, you should probably see your doctor once a year, and they're going to do some blood work on you that screens for chronic condition. You know, they'll test you for hypertension. They'll see if you have diabetes. You know, they'll just make sure you're generally sound. And I think that diabetes is a condition, I think, can be quite bad for your overall health. And, you know, we do use the word comorbidities too much, and there's so many of them, but of the sort of common comorbidities, right? There's like high blood pressure, which we know, I think control has gone sort of pretty bad. On average, is diabetes. There's a whole range of other ones, and there's the more complex ones, like some of those, you know, immune compromising conditions. If you see your doctor, they'll screen you for some of those things. And then there's sort of cancer screening, where, you know, a lot of people in this age range, you know, should get a combination of, you know, cervical plus breast, plus colorectal screening. And then the newest thing, well, it's not even that new anymore. It's been like almost a decade, is even screening for lung cancer. So anybody who's really smoked for 20 years, 15 years or more can get screened for lung cancer. But, you know, as with everything during the pandemic, all of these things have been extremely disrupted, whether it's getting your vaccines you should get as an adult, or, you know, going to see your doctor about like colon cancer screening. And so you can usually fit that in with one visit if you have a family doctor. And I know we're talking a little bit of access to family doctors, and it can be very difficult, but yeah, I know it is almost a mythical concept, Mary Helen. I know, especially if you're living in rural Alberta and Grand Prairie, and, you know, very happy to talk about those are some of the issues I work on as well, like access to primary care. But those are my top. So go for a walk, see your friends, and see your doctor or healthcare provider like just once this year. I mean, those are generally my goals for myself.
That's a good recipe. Like that I can manage, particularly if I can go for a walk with my friend together, and that's 2 for 1. So and it's getting warmer a little bit, so it's not as hard to do. I really appreciate that very practical answer, because the long list of things we're supposed to do for our preventive health is like, we know, lose weight, exercise, do all these, you know what? Okay, yes, it's good to have that list, but it's really important also to have that idea of screening in there. I know that for you, you've been looking at that. So let's just say that you don't have a family doctor and you do want an annual health checkup. You know, short of showing up in the emergency room, what are your options?
Yeah, so if you want some of the screening stuff, I mean, like I think that you shouldn't show up in your emergency department, because they'll probably kick you right out. I think that, you know, one thing that you could, I mean, it varies, right? Like people at walk-ins will sometimes do this, but often not. I think that when it comes to finding a family doctor, it can be extremely challenging. I feel like if anybody actually has a personal challenge with it, if you're just on this call, just email me after, and I'll see what I can do to help you find a family doctor. I'll drop my email in the chat. But it's not easy. I mean, we are trying to get pharmacists to be able to do more of this stuff, actually, because I mean, when it comes to testing for diabetes, it's not that complicated. You know, and the blood pressure thing you can kind of check yourself as well, usually in a pharmacy. But a lot of these other tests, these screening tests, do require lab requisitions or, you know, diagnostic imaging requisitions. And so between walk-ins, trying really hard to find a family doctor and piecing stuff together, like it's this is bad and difficult. About 80% of Albertans have a family doctor. I think that's a lot higher in the urban areas, a lot lower in the rural areas. I don't think COVID has been kind to people in the healthcare system. And so we're seeing a lot of burnout and people leaving the healthcare system as well. And so I guess all I can say is that as we have a bit of breath after these waves wind down, I mean, it's certainly one of the hugest priorities for us working in sort of the access to primary care and public health space. But no, I have no magical solutions other than email me and I'll see what I can do.
Well, that's about the best answer anyone could ever give. And I kind of do the same when it comes to elder abuse cases. The challenges are there are sometimes really difficult navigation. So I'm sure many people will take you up on that. One of the things I wanted to just move to, and this is a bit more of a policy decision. So while you're typing in there, I'm going to answer you, Tammy. Tammy is asking me, who has the power to change income thresholds with the government? Oh, that's a good question, Tammy. Income thresholds are way too low for seniors or anyone low income, right? So she's saying there are a lot of people who can't afford things who maybe are just over the threshold or the threshold itself is too low. And it should be updated like everything else. She says if income thresholds were raised, then there would be less of a population living in poverty. Well, that's true by definition. Actually, there'd be more people living in poverty because if you increase the income threshold for poverty, you'd have a bigger group of people. But I take your point, which is the amount of money given is not equal to the needs of people right now. And boy, is that ever true when we're looking at inflation and consumer price index. And for those of you who are thinking about money isn't connected to health, let me tell you, as I gave in my introduction to the minister, health and wealth are deeply connected. And so short of a magic wand that will give me a lottery winning, I have to think of other things that can do it. And one of the pieces that Tammy is suggesting is making sure that those government thresholds are reasonably. Let me just give you a sense of why that's so important, even in the last couple of months. So there is some good news. The good news is that some of the income thresholds are increasing. One's called the Seniors Poverty Index, and that's federal, and it did go up. It is up, but that was up in 2019. And boy, we know that things have raised even since then. So it was jumped up a bit from where it was before. That's the good news, and that's federal. There are some things that are provincial, but mostly we use the federal version, even in the provinces and territories. So not as bad as it used to be. Some of the other pieces is things like GIS and CPP and OAS do have some tethering to the cost of things like inflation and so on. So it's risen by about 1.1% for those government programs. Ready for the bad news? The bad news is in this year alone, we've gone from about 1.1 at the end of December into January, where it increased into the 2%. In February, it was 5.7% for the consumer price index. And that's the stuff that you spend your everyday money on. Okay. If you're wondering what the consumer price index is made of, there's a list of things that you keep in a basket and they measure how much those things cost. Housing, food, even tobacco and alcohol, a bunch of those things that people use. Okay. This last announcement for March.
Oh, you've muted by accident.
It means that we are absolutely going to have to make dollars stretch farther. And so I don't even think it's just the income thresholds there. I think it's going to be important. We actually are going to need to have some additional financial help from different levels of government. Otherwise, we're going to see this unrestricted income price index going up. Inflation can be good and bad. I think that's important to know. Some people look at inflation and you think, oh no, right? But it means your investments are going up. If you have investments, it means if you don't have money, things are going to be harder for you. And what happens is people in that lower and middle class get squeezed because, as you've said here, Tammy, if you don't qualify, you're really in a difficult point. So what does this mean for preventive health? Well, it means people aren't going to be doing things like buying those fresh vegetables and fruit if they cost too much money. It means that gym memberships may have to become outdoor walks. It means that people are at the back end, maybe not filling prescriptions that they need to fill because they can't afford payments or co-payments. So we know that money and your financial well-being directly impacts your ability to deal with things. It also means you've got more importance around preventive health because acute care is going to be even more challenging as more people are trying to access limited services. So the government is the answer to the narrow question, but I think it means that we all have to do a bit more around our preventive health. And the inflation, again, was not what I was talking about, Yvonne. I was talking about the consumer price index. So that means the cost of a basket of goods that they're talking about, things like housing, food, activities, and so on. That CPI, consumer price index, is 6.7%. Inflation has just increased for the first time. It's the highest it's been in as a jump, but it's been incredibly low too. So as I say, inflation is both good and bad. You can't think about inflation as only bad. It's actually good in some cases, and it's been historically low. It depends on how it's going to hit you, but the consumer price index is hard for everybody. That's a big piece that we like to talk about. Another piece that there was a question about the continuing care, and I'm just going to answer that question and then toss it back over to Health. So one of the questions that we've really seen around continuing care, I'm using that terminology in very specifically for Alberta, but from everybody else across the health and housing continuum, we're talking about things like healthcare. We're talking about what we call assistive living, and in that bucket, we're talking about residential care, long-term care, seniors lodges, some kind of housing plus some help. Okay, that's not 24-hour nursing care. And on the very highest end, of course, we've been really talking about long-term care, and we call those different things where we are, right? Different places call it different things, but I'm going to use the banal term of long-term care because it's the same generic word across the country, but this means personal care homes if you're in Manitoba. This means residential care if you're in BC, and we talk more about continuing care in Alberta. So the broader question has, how has COVID-19 affected that continuing care? So good news and bad news, kind of the answer. So the bad news is it's made it harder. And I think that's not a surprise to anyone. We know that Alberta paid a lot more attention to the role of essential family caregivers during COVID-19. And we're talking about social inclusion and preventive health. And that means that having real people in to help you and see you has been really important. So I think we did a better job on visitation than many other jurisdictions. Not perfect, but a bit better. We have just introduced legislation in Alberta, which brings together 6 pieces of disconnected legislation into one thing called continuing care. And that's going to govern everything from home care right up to that long-term care. I think that's good because it's going to make it easier to put things under one bucket. The bad news is we didn't have enough money in it before, and austerity is coming. And it's going to be hard to meet the needs of both an aging population and the backlog. So it's not a perfect answer. Tammy, you're asking about who investigates when it comes to concerns about that. I'm going to put that information in the chat for you. But yes, investigations are really important. Okay, well, I hope that answers your question, and not an easy answer again. So I want to turn back to you, Dr. Hu. If you had a magic wand.
I love magic wands.
I love the magic wand question. Okay, we've learned a lot of things before COVID, during COVID, and now we're in a new phase of COVID. Okay, if you had a magic wand, what would you do in the next 1 to 3 years? Okay, I'm giving you the ability to do things, but it's a short term, 1 to 3 years. What are 3 things that you would wish we could do in terms of public health to make people healthier? And you can change the system too. I'm giving you a magic wand, okay? You can change the system. What are 3 things that you would wish that you could do to improve preventive health for Canadians and Albertans in particular?
Yeah, very, very good question. I mean, I think COVID has taught us like a lot of things, right? I mean, it has shone a light on, I think, a lot of the inequities that existed in society, or a lot of just a bad thing. I mean, like, I don't think continuing care is the greatest. I used to work in a long-term care and see my patients there, and I think it was like always underfunded as an example. I think COVID let us sort of see, just how certain populations were more vulnerable to infectious disease, which is entirely driven, I think, by things like, almost negligible, like by things like housing and income, and sort of the places you have to go to work every day, like a crowded meat plant. And I think those were lessons that it was good for society to learn, like the bad stuff. And on the flip side, I think there was a lot of good stuff that we sort of had to do to pull together to sort of get through COVID. I've seen so much participation from community organizations in the health space, far more than ever before. And I didn't really use the word community organizations real loosely, but like really what the community organization is like a group of people that represent people, patients, whatever you want to call them. And I don't think their voice was as present in the health system writ large as it was during COVID, when we all had to sort of go all hands on deck. So these partnerships have been sort of really, really awesome. And I think that, and so there's been bad lessons and good lessons. And in terms of what I would do is, like, learn from the bad, learn from the good. But, one thing, and, I've talked a little bit about care deficit issues, which is everything adversely affected by COVID in health, which is everything actually. I would say that one thing that would be really good is if we actually had a plan to deal with some of these things at a sort of government and community and health system level. And I think what's happened is that, everybody who works in the health space has been very overrun with COVID. So I'm pretty burnt out. But any of these things that sort of, whether it's routine vaccines, whether it's the state of long-term care, whether it's like cancer screening, if what happened to any of those things happened before COVID, we'd all be saying this is a bloody emergency and crisis and whatnot. But because so much of it has happened all at once, and there was COVID that was unique in sort of what it made us do to society, like we haven't really addressed it in Alberta and BC and Ontario. Nobody has a plan. And so I would have us have a plan for some of those things, right? Like, and I think we'll get there, right? I'm hoping the summer gives people in positions of organizational authority like some time to think. So that's one wish. The second wish, though, linked with sort of all the partnerships between organizations that sort of like were created during, not created perhaps, but were involved in COVID, is I would like to really see these organizations stay engaged with health and the healthcare system. It's not always very easy. In fact, it's quite challenging, I would say, navigating the health system as a patient, as an advocate, as whatever. And AHS is like this big behemoth of an organization that's kind of scary sometimes. But I think without the input of people, who are patients, who are the community, who actually have the ability to convince people to do things because they have trusted voices, we're going to go back to square one, right? There's been a very wonderful de-siloing that's happened. And I would love for that to stay for the next 1 year, 3 years, 10 years. Like, Laura and I probably would have eventually met like at some point, but, I think COVID accelerated some of those things. And so that'd be sort of my magic wish number 2. And then I think and I should say this, like, this is because like health really is a spectrum, right? Like health is not just what you do in a hospital, right? Health is not what you do just when you even see your family doctor, your pharmacist. By the time you're in a hospital, it's probably not that, it's not that great for you. It's like everything from, like housing to income to education that like leads whether or not you're going to have to see your doctor or go to the hospital. And that's why it's so important that everybody get involved. And I think for my last wish, I mean, I'll say this, like, I do sort of see a path to recovering routine vaccine uptake and getting some of these vaccines covered. I do see a path to things like getting cancer screening rates back to up there to the word, diabetes screening, all those things. And, what I worry the most about is actually this notion of, mental health and social connectedness and loneliness, because I don't know if I see a path to making that better. I mean, not that I need to have all the answers, but I mean, we weren't the best at dealing with it before COVID. And I think we really need to come up with some innovative, effective solutions for like in the aftermath where things have made so much worse. And so those are my 3 magic wand wishes: a plan for us to continue to be friends and somebody to do something really good for mental health.
I think the mental health piece is so important. And, it's a piece that we've normalized a bit of the conversation about, but we don't always have the access to services. A friend of mine who is a geriatric psychiatrist put it this way: you can get mental health services if you don't want them. You can't get them if you do. Now, that's a little bit of an overstatement from her point of view, but until we actually have mental health and therapy covered as part of our services, individual people can't access counseling, psychology often unless they have extended healthcare benefits. And it's a real challenge. And so you end up being a medicalized system where you may not otherwise need to be part of that medicalized system. So I think that's really important here. There was a question about what I think AISH is the assured income for the severely handicapped. I think if you could say if that's who you were talking about. And I'm just going to put the information in the website for you around that question. Here we go. Who governs it? Was it, do you have anything that you need to add about who governs it's Alberta itself, and it's part of, are you looking for a bit more information around how you can get in support? I'm not sure how to help that, but is there anything you want to add on to that, Dr. Hu, at all?
I know that is, it's AISH, we call it. I mean, I just read in the news recently, I think that there's going to be some work to sort of improve the appeals process. But I mean, this is, for people like it'd be the equivalent of ODSP in Ontario. Back to your conversation around fixed incomes and, indexing to inflation. But I mean, the amount of money you get on AISH is not particularly high. And if it can't keep up with the crazy rates of inflation, CPI will be in trouble. But there have been some efforts, I think, to improve this, but this is always something where I wish people get a bit more money on AISH.
Yeah, and there's my little flag. If you do qualify federally for the disability payments, you get our DSPs. Do have a look. And if you're filing your income tax returns, you got 5 more days to do it, making sure that you get that qualification. You'd be surprised at who qualifies for disabled, and you can get a lot of additional tax support. Does this mean there's enough money? No, but you can at least get back some things on your taxes. So do make sure that you check to see if there's a qualification you can get from the federal government as well. Tammy is asking, and this is a question for you, Dr. Hu, are we tracking how many breakthrough COVID cases? So I think when we're talking about breakthrough, we need to explain what that is. It seems like there's a lot, but it would be like to know if there's actual stats. Well, I can tell you, it feels like everyone I know has got COVID right now. When we're talking breakthrough, what does she mean? And are we counting that?
Yeah, so I think by breakthrough infections, you mean the people who get COVID, even though they've been vaccinated. And so, a bit of preamble on this. The original vaccines, well, we still have the same vaccine as we always had. They were very good at preventing infection or symptomatic infection against the other pre-Omicron variants. They were super good at preventing hospitalizations. With the current vaccine, with the current variant, I should say, there is some protection against infection, still very good for severe infection if you get your boosters. But lots of people who've been vaccinated are getting COVID. Certainly, I suspect Laura had her COVID vaccine and she had it. I had my COVID vaccine and I had it as well. And so, one thing, until we have an Omicron specific vaccine or something like that, really public health push has been to prevent severe infection, aka hospitalization, rather than actual just general infection, because the vaccines can't seem to, they probably provide about 60-70% protection against symptomatic infection initially, but within 2 or 3 months that goes down to 20%. But the protection against severe infection remains at 90%, which is why everybody should still get vaccinated, still get a booster. Do we track it? Not really. We don't really track our cases anymore. What we now use across Canada to see how much COVID there is wastewater surveillance. And what that basically means is that everybody, when you have COVID and you poop, there's actually been a COVID virus in your poop. And we can sort of measure the amount of COVID virus in the sewage system to give a sense of our total number of cases. And so in Alberta, for example, in the peak of our first Omicron wave, we were probably having, 100,000 cases, 60,000 cases a day, something like that. And now based on the wastewater peak, it's about 60%, 40% of that. So now we think we're, like just like half of what we were seeing as a peak. And so we don't really track breakthrough anymore because we don't really track cases anymore. But we're pretty confident in those vaccine effectiveness estimates that I mentioned. So yeah, that's a good science question.
Yeah. It is, I think, so much of an importance. I, like so many other people, I was first as long as I was able to get it. I was there in line. There's no question about it. I did get COVID, but it was a very mild case of it. And I know extremely poignantly how important it is to have that. And I'm sure I would have had a much, much worse case of it. And that is critically important. As we're starting to wrap up, let's talk a little bit about how people can get involved. So we have been talking about preventive health, what you can do, besides just eat right and exercise. We've talked about making sure that you have a schedule. It's so hard to know what you're supposed to take. And so 19 to 0 and Immunize Canada and CANH, all of which will make sure that you have on the materials that will follow up, are places you can find out. The reality of circumstances, if you don't know if you've had your vaccines, go get your vaccines generally. I'm not talking about COVID. I'm talking about things like tetanus. When was the last time you had your Tdap? When, dig out those little yellow cards. And if you can't, make sure that that you do get your vaccines as much as possible. We're so careful with our kids, and we often seem to forget that we can absolutely do it. And whatever your cards are, you have good records in Alberta. I have to say, in BC, they're green. In Ontario, they're yellow, and I can never find them. Alberta has been a leader in health information. So as I'm wrapping up here, some practical advice for Albertans, and then maybe we'll talk about some practical advice for Canadians more broadly. Dr. Jaw, if you've got someone coming in, they're 70 years old, they're willing to take their stuff, maybe they're confused about what they should take or what they shouldn't take, and they don't remember, they've got, maybe they got their stuff ages back, but that person comes in, they're willing, they're able, but they don't know really where they are. How do you advise that person to get the steps they need to take around vaccine?
Oh yeah, the great thing about Alberta, it's all on Netcare. I don't know if you guys have seen a doctor open up Netcare, which is basically our provincial repository. And so whether it's a pharmacist or a doctor, we have full visibility. We know all the vaccines you've ever gotten, actually, which is a lot better than the yellow card thing that I think Ontario has. And so, on average, your 70-year-old should get if they've not had it before, a shingles vaccine, one of those pneumonia vaccines, that flu vaccine every year, maybe that booster, the DTaP, tetanus, diphtheria, pertussis thing every 10 years. But it's actually a lot easier to know in Alberta. I think that, if I were to distill that down, we're make sure just get the shingles vaccine once over the age of 50. Get both of those pneumonia vaccines once over the age of 65 on average, and get that, flu vaccine. It'll be the high dose if you're over 65 once a year. And so that it is kind of hard to remember, but at least we have our records all in one place, which makes it a bit easier for your doctor and for you, hopefully.
One of the things people often do is they move around, or we used to move around a lot. And just to give you a sense, I've got kids in all kinds of different places, and they've had shots from one places and boosters from the next and so on. So we know that in Alberta, if you've had your vaccines in other places, but you're due for vaccines, you can get them in Alberta. And so you don't have to worry that you need to go all the way back to a place where you got your tetanus shot when you were 20 years old. If you're now 70 years old, it's okay. There's a lot of confusion around that. In my last few questions, we know that culturally some communities have had confusion or also concerns around particular issues. Have you had some vaccine hesitancy issues show up, and how do you address somebody who may come from a different cultural background and they're perhaps confused or not clear? How do we meet people where they are to reduce anxiety and make sure that they get the right information at the right time?
Yeah, no, and a lot of what 90 Zero focuses on is this. I mean, very simply, I think when it comes to anybody, you should listen to them and listen to their concern. I mean, it sounds so bloody basic, doesn't it? But it's kind of funny. I'm the guy that like they send people who are really against vaccines to. Like, I kind of just try to listen, understand where they're coming from, because I think everybody is trying to do this sort of the right thing, right? I think for their own health, right? And everybody who doesn't want to get a COVID vaccine, I think, they're still trying to do the right thing. I may disagree with them. But that listening, understanding, empathy, and a relationship, I think, matters more than anything. And to Laura's point about how do people get engaged, I love this pilot program they're doing in British Columbia, because, like, at the end of the day, a doctor, a pharmacist is somebody that people trust on average, for their medical things. But if it's a doctor and pharmacist and their friend or their pastor or their community association lead also recommending it, they're much more likely to get a vaccine or do whatever other health thing that's being recommended. When it comes to different communities, it's interesting because there's so much variation. We're getting a lot of these refugees, right, from Afghanistan. We had a bunch of Syrian refugees come in, a few years ago, and there is very little vaccine hesitancy in those populations, because I think they actually see what happens when people don't get vaccines. A lot of the diseases that we've eliminated. So there's no sort of one size fits all approach when it comes to COVID vaccine in vulnerable communities. Calgary, Alberta, done a pretty good job of getting people to get the vaccine. People don't get a vaccine, they don't trust the health system, they don't trust the government, right? And it's really all about that. And so if you can build that trust, and there's nobody better at building trust, I think, than communities, frankly. People will listen, actually, right? And so all of our tactics around those communities from a 19-0 perspective have involved engaging community organizations, people from the community, to lead, to guide. And I think without that, you're not going to get anywhere. It shouldn't be somebody like me just telling you to do things. I probably do that too much.
I think it's so important to meet people where they're at and to understand that their questions are real questions, and to not, get frustrated, and to meet also the awareness. So here's an example that I'll share for you right now, that there's been initiatives in Indigenous communities to make sure that people are understanding the right things. And even as basic, this is in Mohawk, even as basic as putting it in the language of the person. I know that seems so obvious, and yet so much of our information is just only in English and French. And, it's critically important that the cultural norms and understandings and expectations can be met, whether it's this or that. And preventive health, people have a very different sense of preventive health and what that means to them. Although I have to say, eat right and exercise probably feels like the two things that we can all do together. As we wrap up, there's a few pieces that I just wanted to share in our last 5 minutes, and reminding people that they're going to get additional information. They don't have to do anything. They're going to get more information sent to you as well. Let's not forget that we've got all kinds of other things going on that involve preventive health as well. And that includes things like housing. We know that we have to make sure that people have the shelter, and shelter where supports are needed, as a critical part of preventive health. And we've got a large number of resources on housing. We've just put in a big review to the United Nations about what Canada has done in terms of housing. And don't forget that our national housing strategy, which we brought out federally in 2017, has almost nothing in it for seniors. And so we really need to be addressing more in the area of housing. For people with mental health and addictions, we know how critically it is to support with housing that puts people in a place and a space that they can get the treatment that they need. It also means, arts and culture, getting involved and letting that creative side coming out. That's part of health too. And so whether it's joining a group or getting out your paints, or maybe it's even the time to compose your first poem, anything that can help us in terms of listening to music or being engaged in physical movement, that's part of preventive health as well. Look for things like community building. As we're starting to get some of our networks open again, we can also remember that some of that stuff can be done outside very safely. And we know that community well-being and community projects are part of our personal well-being and our personal projects. So let's make sure that we stay connected. The CANH communities are here for you. And Nate was on a little bit earlier If you're interested in being involved at a local Alberta level, we are starting to build out a CANH community there and get involved and active. We're already got a great one going in British Columbia, and we're excited to have you participate and share with us. So information about CANH communities, you can find that at info@canh.ca. Also, information is on the website as well. We've got lots as well in terms of financial well-being. We know we've talked about that today, that preventive health and financial health are close to each other. And it's not just for people who are barely trying to make ends meet, but it's also thinking about how we can make our dollars stretch a little bit farther if we're on fixed incomes. If you were excited and want to make sure that you share this information, you can find us online, and you can find us in terms of 19 to 0, and you can also find us individually. Dr. Haas is active on social media, and so are we. And I've just put some of that information in there as well. Dr. Ha and Dr. Hu and I are individually on here, and as well we'll put in the CANH seniors information and as well the 19 to 0 information. Watch out for more healthy aging conversation sessions across the country, and then a big national session we're going to have in the fall of 2022. Thank you for joining us today. I'm going to give the last chance to say goodbye to Dr. Hu, and we're 1 minute away from closing. Dr. Hu, anything you'd like to share about your organization or where they can get more information?
Well, you can certainly visit our website at 19to0.ca. I've also put my email in the box if people have specific health questions, or I mean, like the family doctor thing. But yeah, thank you. This is really fun. And I mean, I think that, again, you know, COVID's really occupied our lives for the last 2.5 years, but there's so many other things for us to think about and work on collectively. And so looking forward to especially the national conversation on healthy aging. Thanks for spending our Monday mornings with us.
Thank you, everyone. Again, follow-up information is being sent to you in your email, and you'll be able to watch and share this on our canh.ca website. Have a great rest of your day.